Hello friends, this is Dr. Bharat Jagasi, Director of Critical Care Department, Reliance Hospital, Navi Mumbai. So today in this Scripps talk, we are going to talk about interpretation of culture report and concept of therapeutic index. So the points to be discussed, what we're going to cover in this is the time to positivity, terminologies in culture report, what we use, various terminologies, what is MIC, that is minimal inhibitory concentration, what does it mean by breakpoint. We need to understand the concept of therapeutic index. It's very important to know this because it's very useful in choosing a right antibiotic. And also we need to understand the introduction to pattern of resistance because that is what my next talk is going to be on. So time to positivity refers to time taken for the blood culture to flag positive. So if the viral load, if the bacterial load is high, obviously it will flag faster. There'll be lower time to positivity, and also it's an indicator of outcome. So this is how your culture report should look like. It should always flag a time when it was flagged positivity. It is also useful in determining differential time to positivity. For example, we use two cultures from peripheries as well as the central. And the central line positivity is 2 hours earlier as compared to the peripheral. It could be Klapshi and consider removing central line. And this is why it's important to have differential time to positivity. So reporting has various terminologies: susceptible, intermediate, SDD, resistant. So susceptible is when antibiotic is effective in standard therapeutic doses. Intermediate when it's clinically effective in increased doses and frequency. So you can use it there in certain situation by increasing the dose and frequency. SDD, that is susceptible, dose dependent, is important in few antibiotics. Resistant is ineffective in standard or even if increased therapeutic doses. But again, when it's pen resistant, we can choose this antibiotic. The reason being is there's something called as 90-60 rule. So susceptible infection respond to appropriate therapy approximately 90% of time, whereas resistant infection respond only 60% of the time. So we need to remember the rule when we choose the antibiotic. And also there's something called as MIC. This is very commonly used. So this is minimum concentration of antibiotic needed to inhibit visible growth of a single isolate of an organism, important for very definitive treatment of an individual patient. Breakpoint, these are discriminatory concentration used in interpretation of results, susceptibility testing to define isolates, like to let you know whether susceptible, intermediate, or resistant. These levels are determined by various organizations like FDA, CLSI, UCAS. They also review this on yearly basis, so you need to keep a track on it and follow it. We need to understand the concept of therapeutic index. It's very important to know what the therapeutic index is. And what we need here is breakpoint as well as MIC. And because it's a ratio of breakpoint divided by MIC, higher the therapeutic index, better is the efficacy. If lab shows only MIC, clinician gets misguided. And it's very important to know the breakpoint. And if the lab is good, macrobiology is good, they will also give you the therapeutic indexes calculated. So as various drugs have different breakpoints depending on the organism isolated, always choose a narrow spectrum agent with highest therapeutic index. So let's come to the example. If you look here, this is what the set of MIC is. This is what the breakpoint is, therapeutic index is. So there are various few antibiotics which are sensitive. If you look to have the highest therapeutic index, this is what we should be choosing. One is colistin, one is gentamicin. So if you look at this, sometimes what old school of thought, so we're looking for the MIC's value, lowest the MIC, we should choose the antibiotic, but that is not right case. Here I would have chosen colistin looking at the MIC, but if you look at the therapeutic index, it's same for the colistin and the gentamicin. So I can go ahead with the gentamicin in this case with the same therapeutic efficacy because the therapeutic index is same. Again, one more example of E. coli. If you look, these are the varied MICs and these are the therapeutic index depending on the breakpoints available. So you look at the sensitive pattern. So here we have amikacin with the highest therapeutic index. If you look at the MICs, there are sensitive where MIC is less than 1, like in case of gentamicin. So I could have been misguided to choose gentamicin, but look at the therapeutic index. Here is highest in case of amikacin. So this could be the drug of choice, maybe in this cases. I'm not discussing which organ specific or what are the other complication patient is facing. So again, that will change our decision, but this is purely on the culture report. We need to understand where the therapeutic index is, what exactly the therapeutic index is. This is again one more example for you. Amikacin again wins the case here with the highest therapeutic index, and these are the various MICs. So we should be choosing the antibiotic with higher therapeutic index. Mind you, look at the organ you're targeting, also the other parameters of the patient before you rightly choose. So there are certain organisms where we need to repeat the cultures. So these are Pseudomonas, Enterobacter, Serratia, Citrobacter species, Morganella morgani. These are the antibiotics where the repeated cultures are recommended. So you need to repeat the cultures to look for the effectiveness of the treatment and negativity of the report. Now I come to my last slide, mechanism of resistance of antibiotics. So this is a different talk altogether, which I'm going to come next time. We need to look into the various pattern, intrinsic and acquired. So intrinsic pattern are very important to know because there are certain antibiotics which are intrinsically resistant to certain, there are various organisms, beg your pardon, there are various bacterial organisms which are intrinsically resistant to certain set of antibiotics. So those antibiotics, even if such is flag positive, we shouldn't be using it because those are intrinsically resistant. Acquired pattern could be mutation or plasmid or something else. I'll come to that in my next talk. Thank you. Till then, it's far more important to know what person the disease is rather than what disease a person has. So you need to know exactly what to be used, when to be used, in what cases. Thank you. See you next time.